Prevention Action Alliance webinar, school-based health centers in Ohio. I think you're really going to enjoy the content today. And our speaker for today is Catherine Bissett. Catherine serves as the Ohio Alliance's Director of Initiatives. She provides leadership and oversight of the organization's capacity building, technical assistance, outreach programming, which she is very good at. Catherine brings extensive experience to Ohio Alliance, spending the last decade of her career developing equity-focused school-based health programs in Maryland and Ohio. She designed her career to focus on being a partner and ally to her patients and families. Her prior roles include working with Metro Health System's school health program, Johns Hopkins University, Rails Health Center, Case Western School of Nursing, and most recently serving as independent SBHC consultant with the Ohio School-Based Health Alliance Center. Sorry, I lost my words. Catherine is a graduate of the University of Richmond and the Johns Hopkins School of Nursing. She lives in Shaker Heights, Ohio, yay, northeast Ohio. And Catherine enjoys hiking, traveling, reading, and cooking with her 4 children, dog, and husband, Scott. Does the dog cook too? And those are all things that I enjoy as well.
Well, thanks, guys, for that kind introduction. I'm really honored to be invited here. I'm really grateful to our friends at Prevention Action Alliance for including us. I know there's lots of different audience members with different baseline understandings of the school-based health center model. So forgive me if a little bit of what I talk about today is basic for you. I'm trying to just get everybody up to speed on the model and how I think you might collaborate. So, like the ladies talked about, I work for the Ohio School-Based Health Alliance. We're the only nonprofit, independent, statewide organization created to advance and support the sustainability and expansion of school-based healthcare. We are the state affiliate of a national organization, the School-Based Health Alliance, based out of DC, that you might have heard about or know about, have their upcoming national conference next week in DC, and I will see a few of those familiar names there. So excited to be with you together in person. Our organization has been run for a long time, since 2002, as a volunteer-led organization, and then was sort of reborn and relaunched with a paid staff in 2022. As Juliana mentioned, I'm a nurse by training, and before my role here as the Director of Initiatives, I got to start up and run several school-based health centers, both here in Northeast Ohio, where I live now, and in Baltimore, where I'm from. So that was the honor of my lifetime, and I'm really excited to bring all the lessons I learned and all the mistakes I made to this role now to support our operators around the state. So our organization has these 3 areas of focus. As Juliana said, I spend most of my time up in this capacity building bucket, which really means walking alongside the healthcare operators and school districts that implement this model, to do so with fidelity and to reach as many kids and families as effectively as possible. We also spend a lot of our time on policy transformation, which is just the fancy way of saying education and advocacy. We're really proud of that work that we do across the state and at the State House in Columbus. And then we do data tracking and evaluation. So I'll show you some maps and metrics today. My colleague, Dr. Rachel Schilling, leads that work, and we're really proud to have just closed the 3rd statewide annual census, and super grateful to the healthcare operators for completing all that information so we can sort of demonstrate the impact of the model statewide. We're really grateful to the support of our generous funders and partners for enabling those 3 buckets of work. I want to say to you guys quickly before we jump into the objectives that I cannot see the question box the way I'm sharing today. So Leah and Juliana will please feel free to interrupt me or stop me if you think I need to address something in the moment. And if not, we will have questions at the end, but happy to have this be conversational if folks need something answered in the moment.
Absolutely.
Okay, thanks. So here's our objectives for today, which also sort of serves as an agenda. We're going to spend the first part of the presentation talking about the model as it's defined in the state of Ohio. Then we'll talk a little bit about the landscape throughout the state. I know we have folks from all over. And then the third section is we're going to just explore some opportunities for collaboration between the prevention professionals, behavioral health agencies, schools, and school-based health centers to strengthen those prevention efforts and improve outcomes for students and families. So we'll get started talking about the model. So I'm sure if I was in the room with y'all and could see your faces, I would be asking, has anyone ever been inside a school-based health center or live in a district here in Ohio that has one? Feel free to put that in the chat because I'd love to see that later. And I know those of you who work in one have been inside many. So I think if you have seen one, if your kiddo's school has one, if you've already collaborated with one, you might be able to testify to the other folks in this virtual room that they're really nicely designed. They look beautiful. You walk in the door and you think, oh goodness, I'm in a real doctor's office inside a school hallway. You might have been super impressed by how compassionate the care was, or how well the providers, nurse practitioners in the room knew their patients and families. But you might not have been able to see at first glance or on a tour all the potential they really have to impact these three categories across the top of the screen here. I do know the folks in this room understand the power of early investment in the physical and mental health of kiddos to impact all sorts of outcomes, right? Because most of you have your work structured to do just that. And that's what school-based health centers aim to do too. And really, as I talked to several behavioral health expert colleagues as I was preparing for this presentation, my one close colleague said, well, Catherine, school-based health centers are a prevention mechanism. And that gave me a little bit less of an imposter syndrome talking to this room. So that helped. She explained, school-based health centers are a prevention mechanism against damage of untreated chronic issues, right? Against unnecessary use of the emergency department, against unidentified worsening mental health symptoms, and against chronic absenteeism, not making it to graduation, you name it. So a lot of the things that we worry about for our youth in Ohio, school-based health centers are designed to prevent. So we are, as I said, an independent nonprofit organization, but we are lucky to work really closely with the school-based health center team at the Ohio Department of Health. And through our contract with them, and with some support from our friends at the Health Policy Institute of Ohio, which some of you may be familiar with, we convened a working group a few years ago to define what we mean by school-based health center here in the state of Ohio, because you all know, right? Defining what you're talking about is really important when you're alleging potential impact or reach or outcomes. So that working group had representation from about 40 organizations, super generous. People volunteered their time for about 9 months. We convened them both online and in person. Painstakingly, they came up with a definition made up of these 6 key components. I don't have a slide of the full word of definitions because the text becomes really, really small. But if you want to see all the words, which are very thoughtfully put together, that is found on our website. But these 6 key components are how we normally teach about the model. And some of you here may have seen these slides before. We think it's really important to talk about it a lot. So the last part of today's presentation, as I told you in the objectives, is dedicated to ways that school-based health centers and BH and prevention folks can work together. But you're going to hear me weave some of those tips throughout this section too as I go through the key components. So first, on-site school presence. So I just want to pause here and say that the 6 key components we're talking about, this definition refers to the traditional brick and mortar school-based health center. I'm sure some of you might have seen like the big, beautiful mobile units in the counties where you live and work, or have known about telehealth. We're going to talk about those other models of school-based healthcare too. But key component for the traditional model as it's defined is that school-based health centers are built either inside a school building or on a school campus. but they are operated by a healthcare provider, usually a community health center, an FQHC, or a hospital system. And employees inside the school-based health center work for that system. So for the rest of the presentation, I'm going to call that organization the healthcare operator or the operator. And as those of you who work for a BH agency know really well, within the walls of that school-based health center, HIPAA reigns supreme, right? This is not a situation whereby a second grade teacher gets to walk in and say, oh, what was the diagnosis of my kiddo I just sent down, right? There's a really thoughtfully designed wall, a HIPAA FERPA wall with really smartly placed doors and windows to enable limited information sharing. But when you walk in that door, that's a HIPAA secure facility. And protected just like an outpatient practice, which is really important to explain to parents and families. But being on site, we call these the key components. I sometimes call them the superpowers, right? Being on site is one of the superpowers of a school-based health center because school-based health centers can be super responsive to student needs and prioritize them on their schedule, on their template in a really smart way. Understanding that schools are often the center of our communities, they may also see school staff, parents, family members, other community members. And in the rural parts of our state, this is incredibly important. So comprehensive primary care, we call school-based health centers a choose your own adventure, right? We have families who use them in all sorts of different ways. Some families might use them just like in urgent care, just for acute issues, if their kiddo gets a sore throat at school or a sprained ankle. But lots of families really love the care so much and develop a real rapport with the provider, and it becomes their medical home too. And if we say that we're going to offer comprehensive primary care, it's really important that they offer the same level of service that you're finding at your kiddo's outpatient pediatrician. So that means blood draws, immunizations, lab testing, some point of care testing, all of that. Because we don't want to say to families, yeah, we can meet your needs, and then we have to send them to a second stop to actually have their needs met. We also have many SBHCs that take it a step further and have integrated behavioral health staff right on site, or vision or dental. You can see here a beautiful dental laboratory up in the top corner, in the bottom left, a big rack of glasses. So the services that are offered in any school-based health center depend, right? And they should be designed in response to a community health needs assessment. And that needs assessment really should factor in the work being done by all the other organizations in the community. This is a really key part of collaborating with your organizations, because school-based health centers should not duplicate what's already going on and working well for families. They should just extend the potential and collaborate and complement. So I could talk all day about comprehensive primary care, but I won't because we only have an hour together. But the school-based health center model is really based on this ideology that we healthcare professionals need to meet kids and families where they are and address the needs of the whole child and the whole family. So it makes sense that lots of our operators around the state of Ohio are focused on universal screening to do just that, right? To meet the needs of the whole child and the whole family. When I say universal screening, I don't mean just the age-appropriate mental health and risk screenings that you guys are experts in, but also social drivers of health screening. So when families do screen positive for food insecurity, for example, SBHC staff have worked long and hard before they even ask the questions, before they open their doors, to have workflows in place to quickly connect them with those needed resources. You can see here the percentages from this last census I was talking about of SBHCs offering other service lines. But at all SBHCs, we see robust case management supporting families with referrals, with scheduling appointments. So even if they're one of the 81% that don't offer vision services, they really do a lot of hand-holding and support for families to get their kiddos' classes or get to the resource that they need. Transportation, appointment scheduling, translation, you name it. And I want to highlight this as one area where collaborations between school-based health center and behavioral health or prevention agencies really can shine. If you leave remembering anything, just remember there is no wrong reason to refer to an SBHC. So I think some people think, oh yeah, we have this cool resource, but like it's only for checkups or headaches or menstrual cramps. And really there's no wrong door. So if you are serving a kiddo or a family, regardless of what need comes up first, whether you think, oh gosh, they're really bad untreated eczema, I'll refer them down there, or I need help with medication management. I think this kiddo really does need an SSRI and my current agency doesn't have a psychiatrist. Or if you've just heard from mom that part of the reason they're so stressed this week is because their SNAP benefits just got turned off, or she knows they're going to be evicted, those social driver of health reasons are very legitimate reasons to refer to school-based health centers. And I just want to like acknowledge the elephant in the room, right? This is a really tough time to be working in the field that we've chosen. And the families that we serve are really struggling. So it's nice to have partners to collaborate with when you are the first person that hears those hard, scary health, endangering circumstances. It's really nice to be able to pick up the phone and say, like, what do you have for emergency food delivery today? So we encourage our school-based health center operators as soon as they start a planning process to figure out what other agencies are working in this district, what other resources do we have access to, make those connections, and then really truly write it down, map it all out, what connections and referral solutions each agency has, and develop referral connections and pathways, make friends with the other agency representatives, and then set regular times to meet so that when a family comes to one of you, they actually have the resources that all of you offer. Okay, stepping off my soapbox, promise. Maybe not. So continuity of care, building upon.
Just 1 second.
Yeah.
Kathleen,
Yeah.
I'm sorry. Sarah had a question. She said, do you screen for tobacco nicotine use?
Great question. Yeah. So, I can't, our census asks a lot of these questions, and I can get you detailed information on how many are screening for tobacco use, but lots. We have over 40 operators of school-based health centers throughout the state, and they differ in their practices, but that's a really common one. And we actually ran a learning collaborative geared at exactly that, at tobacco risk screening with our partners at ODH. And so I'm always happy to talk more about the learnings that came out of that collaborative and the solutions that different operators have landed on. Okay, so continuity of care means, right? You all who are parents know, like, I'm going to just give you a warning right now. My nanny called out sick today. So my husband's here, but if anyone comes into my office, you'll know that continuity of care is really important, right? Your kids don't just get sick on a Tuesday or Thursday. And if providers are only in the building on a Tuesday and Thursday, they've missed the power to disrupt absences on Monday, Wednesday, Friday, right? Because that's one of their superpowers, is by having an operator right there. We don't have to send kids out to get care. And you guys who are parents know that when you do have to pick up your kiddo for a sick visit, you rarely bring them back, right? No judgment. You've got to get back to work. It's already 1:45. School's over in an hour. School-based health centers can see kiddos for acute needs and get them right back to class quickly. And that disrupted absenteeism is one of their superpowers. So in addition to our school-based health center operators having these regular and predictable hours, this continuity of care piece also means a lot of that care coordination piece that I already talked about a little bit, right? They are going the extra mile to ensure consistent follow-up, to make sure they get the parent on the phone after that visit, to make sure they're communicating with the primary care medical home if a family still has an outpatient pediatrician that they're seeing, to do warm handoffs, to communicate about different prescription changes they've made, and to make sure that their families know where to access care if the school-based health center is closing over holiday break or over the summer. This, I'm sure, is like really obvious to all of you working in BH agencies, right? We worry about our kiddos on the days schools are closed, and I'm sure this is very similar to the way that you work. So that continuity of care piece is not only important for like the Monday, Wednesday, Friday when you might have strep throat, but it's also really impactful in the management of chronic disease. So asthma, for instance, I'm an asthma nerd and I've done lots of my research work in asthma. If there's a nurse practitioner on site, for instance, and the school nurse did not yet get an asthma inhaler this year, she can make a referral for a student who already has a consent on file to the school-based health center. The nurse practitioner can treat that kiddo with the nebulizer and the albuterol she has in stock in the school-based health center. And that potentially is preventing a 911 call, getting and also getting the nurse and the family all the medication and paperwork that they need to prevent that happening in the future. And I know you all understand too that effective management of chronic illness contributes to better mental health, right? We see lots of correlation of anxiety symptoms between poorly managed disease states. So it's another really important reason to refer, right? If you're running a prevention group and you have a third grader who keeps falling asleep in it and you're thinking, oh gosh, really poor sleep hygiene, I want you also to think like untreated sleep apnea. Can I refer him over to the school-based health center and get family connected with the sleep study they need? And let's make sure that's not actually a physical solution that we can address. So I'm preaching to the choir here on this point. But when we talk about the school-based health center model, we like to highlight how important it is for youth and in particular adolescents to get comfortable with healthcare providers, right? We know sort of the key to success in managing your adult health are these like self-efficacy and advocacy skills. And when nurse practitioners are not wearing their white coat, but they're actually walking through the cafeteria every day and saying hi, or they're sitting in the stands at the football game, kids and teens get to know them. They see them as a real person. They don't see them as this like scary doctor up on the hill. So they teach those self-efficacy and advocacy skills. They teach kids how to know how to ask for what they need with confidence, how to navigate a system. My favorite thing to do with my high schoolers would be have them call and make their own appointments, like for specialists or for dentists in my office. And they'd be on speaker and I'd be behind like, yeah, that's right, say that. And I would always get kids who graduated high school, like texting me from college or from work and saying, Nurse Catherine, you'd be so proud. I scheduled my flu shot and I wasn't scared to make the call. So that co-location and that familiarity really helps build those advocacy skills too. Okay, so this one is really straightforward, right? School-based health centers, even while we're removing all these barriers to care and very regularly seeing kids without their parents at the visit, they follow all state and federal laws and they center family input, right? So it's a superpower that we can see a third grader for their well-child check without mom having to leave work. But what they do offer is, mom, you want to telehealth in? Mom, you want to be on speakerphone? If she can't do either of those things, let's talk to you before and after the visit and get all the information we need. So just because we're making it easy to get care doesn't mean it's not all completely lawful and that parental consent is at the cornerstone of everything they do. And again, preaching to the choir, you all have long understood the power of partnership, right? We take the systems that impact kids the most, like physical healthcare, mental healthcare, education, we put them together and they all become more effective. Teachers get to focus on teaching and they have backup from your organizations, from my school-based health centers to help them figure out, like, how am I helping this 10th grader in my class whose anxiety symptoms are so crippling that he can't make it through a whole class period. And similar to how BH agencies work, this partnership is really thoughtfully designed and then laid out like in a memorandum of understanding or a contract between the outside healthcare operator and the school district. And that MOU addresses all sorts of things from like who fixes the toilet when it's clogged to how do we really responsibly share information about our students and patients. And when done well, school-based care is really welcoming and affirming and reflective of that community input. So we see school-based health centers designing like everything from their physical space, their lobby, all the way to like how their pharmacy delivery might work based on the wisdom that family members and students give them. So that co-location is not the only thing that's powerful here in that partnership. It's really that the school-based health center and school staff and other agency staff are working so effectively behind the scenes that a family just feels wrapped in care, right? They feel like, okay, when I've signed the consent and the appropriate release of information, what I talk about with the nurse practitioner is going to be really clearly communicated to the school psychologist. And so my kiddo is going to have a nice continuum of care. And talk about a superpower. That kind of collaboration certainly is one. And you know, right? Like when a family feels welcomed and affirmed like that, they're far more likely to continue in care.
Catherine, there's a question.
Yeah.
From Amy, what happens during the summer and the employees?
Great question. Yeah. So again, I have that specific data in the census. A lot of our folks stay open in the summer. And that's codified in their MOU that even when the school building closes, they're able to stay open. That's easier when they have an external door. Some of our operators who have many centers, for instance, like our friends at Nationwide, they run a lot of school-based health centers. So they close some and shrink their staff to a few, and they communicate ad nauseum with their families as they're going into spring about where they can seek care in the summer, because it doesn't make sense to keep them all open. They all are excellent at saying like, okay, Christmas break, when you third grade teacher who I've been managing your blood pressure medication, this is how you get support on Christmas break. These are our outpatient centers you can go to. This is the number that you call. And so they're really diligent about communicating how to get care when the school building and they do have to close.
There is another question. Sorry.
Yeah. No, not at all.
What funding sources or grant opportunities are commonly used to support behavioral health services within the school-based health centers, particularly for Medicaid serving populations?
Yeah, I love this question. Gosh, this is a smart audience. So all school-based health centers bill insurance. All of them bill Medicaid and private insurance, the same as any other, pediatric office or behavioral health agency. Where we often see them seeking philanthropic funding or state grant funding is in the startup period. And so part of our work with the Ohio Department of Health is that we are the official technical assistance providers for all their current grantees. And a major part of our advocacy work is working with the governor's office and the state legislature to get GRF, General Revenue Fund dollars to support school-based health centers. So two biennia ago, we got 15 million in the state budget. In this last biennium, we got 20 million. That has gone to planning, startup, and expansion of school-based health centers statewide. I'm going to talk a little bit more about our current funding opportunity in the end of this presentation, but that startup or expansion dollars acknowledge the fact that school-based health centers are less traditionally productive than an outpatient practice, meaning, right, that we're expecting these nurse practitioners to take their time to be with a kiddo who's not with their parent, to maybe see 12 or 16 kids a day instead of 26 kids a day like you might in a traditional practice. And so that additional state or grant dollars helps make up the difference between what you're gaining with the traditional reimbursement and what the time of your operators and the supplies and the furniture and all that cost. Always happy to talk more about that. That's a big part of my job. All right, great. So the last key component you've stuck with me is the system alignment, right? So it just means deliberate setting of goals together. School-based health centers arrive in a community where there's already a lot going on, and they don't take the place of the school nurse or the psychologist or the counselor or your agency or the prevention work. They need to see the map of what's going on and fit in where there's still gaps. So if there's a prevention agency working in a school with a school-based health center, there's a lot of room for system alignment, I think, right? Like, are you guys running a group on healthy sleep or nutrition, you could invite the nurse practitioner from the school-based health center to come in and be a guest speaker and talk about like what lack of sleep does to an adolescent physiologically. And the opposite too, right? If a school-based health center is seeing a ton of kiddos coming in screening positive on that tobacco risk screener, as you asked about, can they work with the prevention agency to be running groups on tobacco prevention or cessation? So this is, when we say flexibility design healthcare delivery to promote academic outcomes, it sounds really fancy. It's not. It just means you have a junior on the schedule, you call him down, and the math teacher says, oh, he has a test this period. You move him to the next period, right? That's part of what system alignment means. Continuum of care means you get the right release of information so the nurse practitioner can go to the 504 IEP meeting and give her input on the interventions there. That's what system alignment is. Real quick, you made it through these 6 key components. Next, we're going to watch a little video before I talk about the state landscape and ways to collaborate. These other models were added in that definition work. So mobile units are these big, beautiful exam rooms on wheels. They're excellent for serving small rural communities, or to be honest, big urban districts where we can't build a school-based health center in every school, but we want to bring care right to where kiddos are. Portable providers, that means you're rolling a big suitcase or tote of supplies that are often used for dentists or optometry, and you set up in an auditorium and you provide care to kiddos for a period of time. Telehealth is pretty self-explanatory, but they're really nice systems, right? They're not like you're talking to your doctor on your cell phone. There's a camera on one side with peripherals, so an adult there can help by holding like a stethoscope to a kiddo's chest, and a nurse practitioner or a doctor on the other end can listen to their lung sounds. Hub and spoke means that we figure out a way to get kiddos from every building in a district to the school-based health center at the high school, often using transportation. And school linked means there's a Metro Health practice next door to a school. That's these community members. How do we create safe private access for the students from the school to walk over to that Metro Health practice and get all the benefits of a school-based health center just from that closeness? All right, Leah, they did it. They get a 5-minute video. So you guys can see this model up close in action, and then we'll come back and do the landscape.
Advantages of having a school-based health center for our students and our staff are endless.
A great asset to have.
Extremely effective, great impact in the way the kids learn.
Help students to become whatever it is they want to become.
Truly takes a holistic view of the child to deliver care within the greater ecosystem and all the other supports that the school already has in place.
School-based health centers bring care directly to the school setting, where children spend most of their day, removing barriers to accessing care and serving as a reliable and trusted space for students to receive the healthcare services that they need.
School-based health centers give our children the services and supports they need to reach their full potential. The traditional healthcare system isn't designed to reach every child, especially children in rural areas, from low-income families, or communities facing provider shortages and transportation challenges.
Being able to provide medical care within rural communities makes the biggest impact. The access is also great for working parents who may not be able to miss a lot of hours at work.
For a lot of our students, we are their medical and dental home. So the first time a second grader goes to the dentist is in our place.
I have students that just come in the clinic just to say hi and they just need a hug, but then you have those staff members that do just the same. Like, I just want to see you, I just want to make sure you're here and you're okay. And having those relationships built with the students and the staff is amazing.
Anything that you can do as a leader of a school to deliver more access for the health and well-being of your students and your greater community will come back to you and pay dividends.
These children, they're our future in society. You know, you are helping to create a hopefulness, having more healthy and bright futures.
We're in this to help kids and to support our students and to improve their overall health and life and academics.
We can help impact their attendance. If they're healthy students, they learn better. They do help to keep kids in the classroom. And if kids are in the classroom, then they have the opportunity to learn.
We are far away from other healthcare. This allows them to step out of class, be seen, and then go back to class to where they're not missing that time and that education. It is definitely helping with school attendance as kids are able to get that healthcare quicker than they were able to.
It's huge in our family because attendance with our children is important and education is important.
Teaching these kids independence and how to take care of their health.
Our community is always very thankful that we're here. As they find out that we're here, they're very appreciative and excited to have healthcare so close to their community.
With them, I want them to know that I'm not just their medical provider in a sense, and I'm there for them in any aspect of their life that they need.
The schools generally are the center of all the activity within the community. Being a community-based, school-based health center provides that medical support, keeping kids in school, keeping kids in class.
When you provide wraparound services in the building where children spend the most time outside of their home, they're able to get the care that they need and get back to class without missing much content. Parents are able to stay at work and be productive members of Ohio's economy, and needs get met so that teachers can do their job and get kids through their grades and ready to graduate on time.
When we invest in school-based health centers, we are investing in the future of Ohio's communities.
One of the things that I really believe in working with children is that we're seed planters. You know, you are planting the seeds of these experiences in children.
Our state leaders to advocate for funding and development of school-based health centers across the state so that way more children have access to these critical services.
And at the end of the day, they're happier, healthier, and they can contribute more. This might be the most important thing we do for our students over the long term of their lifetime.
Okay, great. So we will quickly go through our latest census. Let's see, this one, not this one. Okay. Oh, no, not me. Okay, great. So, or do you want me, Leah? Am I undoing what you're doing?
No, it's totally up to you. If you,
it's up. Sorry, I'm like micromanaging you. You be in charge, Leah. I'm gonna talk. Okay, so This is our a little bit about our annual census. This data is reflective of the 25-26 school year, and folks self-report this. So it's a lot of work. It's not an automatic thing. They have to fill out a very onerous Excel sheet, Survey Monkey thing, and we are really grateful to them. So we have an 84% response rate, which has gone up every year. We're really proud of that. One thing that we did this year was that we operationalized that definition that ODH commissioned us to make. And so to be counted as a traditional brick and mortar school-based health center, you had to meet that definition. And therefore the number went down a little bit from the last year. Now, all of those other models are incredibly important, wonderful. They're just not counted in this verified number. We have 125 verified, right, which means they gave us all the information on the census, but that's an undercount, and more are opening every month through grant funding. So we estimate there's more than 140 right now. And here's where I want you to look at this map. So if you're working in one of these counties, you might have one. And my mission in life is to fill up all the gray into red. What the gray doesn't show is that a lot of those counties have mobile or telehealth serving them. So I don't have that map for you today, but always happy to give you details on if you live in a gray county, what alternative mechanisms are going on there. This map shows you the distribution of brick and mortars in a little bit more detail. The red are the verified, for which we have all the information. The black are the unverified that we know about, they just haven't completed the census. Again, this does not show mobile, telehealth, hub and spoke, all of that jazz. But when we get that map, I promise to share it.
Catherine,
yeah.
Someone said in the chat, Sarah, you may mention this later, but is there a way to get a list of locations within the county?
So Leah, the link that I gave you to the census map, if you could pop that in the chat, you can go to that and you can click on all of these and get the contact information, see what district they're working in, see who operates them.
Thank you.
But feel free to email me, Sarah, and I can help you with more specific questions. But the map is interactive on the website, and I think it's pretty good.
And that link is popped up on there now.
So thank you. These are just a few metrics of like here on the left, you can see the percentage of the different patient populations served. So when we talk about the power to impact all the kiddos who surround, all the people who surround a kiddo in their life, we see 46% of our school-based health center operators seeing all community members, right? We see that number go up every year and we'd love it to continue to go up. Some of our operators are children's hospitals, and so they will never be able to see all the community, right? But they will be able to see children. So when you see that 65%, that's where the difference there, that's how we explain that difference. And then just as you're looking at the services offered by school-based health centers of particular interest to this audience is behavioral health. That N, right, or that denominator, that's only 94% of our, or 94 of our school-based health centers responded to this question. So 75% of that 94 are providing behavioral health services. We know that number is actually a little bit higher if we'd gotten all 125. So the census is a work in progress. Always happy to connect you with operators working in your community. They're incredibly responsive and collaborative and would be happy to share with you what they're doing and figure out what you're doing and figure out how to collaborate. Which leads us to our last section. And thank you guys for hanging in with me. I want to leave a few minutes for questions, but I'm just going to blitz through some ideas about how you can collaborate with school-based health centers. So I'm not an expert in prevention work, and I hope you'll give me some grace on these ideas that I've sketched out and give me some additional ideas if you have better ways or smarter ways to integrate. But here are my ideas. I've already talked a lot about universal screening and how proud that makes me. You all have the dozen stories in your brain too of kiddos who you caught who were really suffering in silence, that universal screening can really be life-saving for. You know, the AAP can make all the recommendations in the world about recommended screening at different ages, and we're so grateful for those. But if you're a family who can't access primary care, they're meaningless. And so school-based health centers removing those barriers to care really does save lives. And school-based health center staff do a lot of work to prep for what they'll do when they get a positive screener, right? Like a high PHQ-9. And that often includes looping in other partner agencies in the building. And this is a key place where you guys are really integral in collaboration. I want to add too, we talked about some social drivers of health. School-based health centers are also using screeners that address physical needs. So they're using screeners to like gauge risk-taking behavior for sexually transmitted infections or poorly managed chronic diseases. Those things may not come up naturally in the course of a visit, so screeners help remove implicit bias and make sure that we're getting all kiddos the same questions. And so you know well, right? Like the better we can manage an asthma symptoms of a fifth grader, the less anxious he's going to be about going to gym or even coming to school. Or the sooner we address those risk-taking behaviors of an adolescent, the less likely they are to have the emotional turmoil and fallout that often comes with a sexually transmitted infection diagnosis. So universal screening is my idea number one. Psychoeducation is number two. I think school-based health center operators would make you proud, you experts in psychoeducation, because the providers have so much more time with their patients, because they're well known to their patients. They have a lot of power to address those tough and uncomfortable topics. So they're digging in, they're talking about warning signs of suicidality, about intimate partner violence, about substance use, sleep hygiene, stress relief, like you name it. And they're empowering little advocates. They're like, what's worrying you in your group of friends? Like, what do you need language or resources to help support you? And they're always looking for resources, right? So if you have particularly good handouts or posters or scripts, please collaborate with the school-based health center operators working in your district. They would love your resources. And then, most explicitly, we have lots of school-based health center operators doing, like, as part of their behavioral health service line, doing tier 1 prevention group work, getting referrals from the school nurse or counselors, getting referrals that are coming out of what started as a physical health appointment. And well, there's a ton of benefits to these groups, right? They tell us that kids love them. They feel excited to get pulled from class and go to groups. That like the socialization is really positive for kiddos, especially, kiddos coming out of COVID. That the group norms help like reinforce wanted behavior. And to be honest, that especially for our rural operators, who are short-staffed in their BH staff, that these groups help them reach a lot more kids in need than they could with just doing one-on-one appointments. So those are 3 ways I think school-based health centers are contributing to prevention goals. Here's what you could do. Here's how you can support them. I beat this drum so often, my colleagues want to kill me, but I really think it's incumbent upon us to build bridges between different organizations to support families behind the scenes. So even for those of you who don't work in school districts, I'd love you to click on the map. I'd love you to see if there's school-based health center operators working in the community where you are, because the kids and families you serve are involved in the school district and they take referrals from anywhere. You can be a community-based organization and have a family on the phone and call to try to get them in at their school-based health center, even if you're not embedded in a district. And those operators love to come rep their services, right? So they would love to come work an event that you're hosting, or to collaborate on a specific patient or to develop interventions together. The partnership is key to their success. They're often really slim staffed as well. So when you have that relationship developed, they're just a call away for like either your patient needs or to troubleshoot an issue or design something bigger together. I know we're getting close to the end, but I want to make sure that I talk about the current funding opportunity. I saw that in the chat too. Thanks, Stacy. If you are working in a school district that doesn't yet have a school-based health center and they want to talk about it, please send them my way. My email is in the chat, and this is the bulk of my job, is to support school districts and school-based health center or healthcare organizations that want to get started. And that includes like talking to superintendents and school boards all the time about what their first steps might be. And second, there's a current funding opportunity open till July 20th. The Rural Health Transformation are a federal pool of money that states applied for and outlined priority areas. And Ohio outlined school-based health center expansion. Leah put the link in the chat. Ooh, that came out blurry. Okay, well, hopefully you know what county you live and work in without being able to read the name, but happy to get you that in a clearer form. If you work in one of the green counties, you're eligible for rural health transformation funding. The RFP is aimed at healthcare organizations. So they want them to partner with the school district, but the primary applicant has to be an FQ, a hospital system. And there's 3 options. So you can apply for planning, startup, or expansion. And the one that's most applicable to most partnerships is planning. That funds the 2 partners for a period of time to do a community health needs assessment, to convene an advisory group, and to develop like a business plan and figure out if that's right for them. So if you work for a healthcare organization or you know someone who might be interested, please send them this RFP and send them our way. We're happy to help them. And then if you do work in a red county or you do work in a community with school-based health centers, the ask to you is a lot easier, right? It's help your families complete the school-based health center consent form. Know where that is. Talk about it all the time. Get to know the medical assistant or the nurse practitioner so that you can pick up the phone and refer patients back and forth. Come up with a system to create, a release of information process so that the kiddo who you're seeing for therapy and who the nurse practitioner is seeing for med management can talk really regularly about how to address that kid's needs appropriately, and just become a team behind the scenes.
Catherine.
They can help you. Yeah.
Oh, I'm sorry.
Last slide. Can I do that?
Last slide, and then I'll read off a couple questions.
Awesome. Okay, last slide, and then I'll put this down. My face will come on. They can help you in all sorts of ways. They can help with medication management for behavioral health concerns. We have lots of NPs partnering with outside agencies to do attention meds, SSRIs, you name it. They can help manage physical health concerns that you know are contributing to your kiddos' issues, and they can help in addressing those social driver of health needs. And I promise they will be a good partner to you. If you want more information on our website, here's our toolkit. That's a great place to start. You can sign up for our newsletter, and these are our regular meetings. So when we send you all these slides out in PDF, you can scan these codes. You can also find it all on our website.